Anticholinergic. If we recall from previously, the normal function of cholinergic, parasympathetic nervous system controls the airway diameter predominantly, and so the neurotransmitter ACH or acetylcholine binds to ACH receptors on the surface of the bronchial tree, causing bronchial constriction. So that's how it normally works. The anticholinergic, so the opposite of it, anticholinergic effect would cause some blockage or blocking the acetylcholine, which then causes smooth muscle relaxation and also decreases secretions in the COPD or airway. So just to give you an idea of what a COPD or patient looks like. So COPD, it is basically emphysema, chronic bronchitis, and they have a chronic airflow limitation. So a lot of the times they're easily fatigued, they have a lot of respiratory infection, and they're quite recurrent. There's a lot of wheezing. You'll see them, especially at a later stage. There's a lot of pursed lip breathing, chronic cough, barrel chest, dyspnea, prolonged expiratory time. So they have digital clubbing, so clubbing of the nails. They have orthopnea and so on. So this is where we use the anticholinergic often. So the therapeutic effect of anticholinergic will be bronchodilation, so opening up the airway. The indication, so common indication for this is prophylaxis for asthma exacerbation and COPD or chronic obstructive pulmonary disease controller. The action is slow and prolonged, therefore it is more of a controller. Some precautions, possible systemic anticholinergic effects. So although it's mainly for the respiratory system, it does have some systemic effects. So side effect, sometimes difficulty with vision. So a common way to remember side effect of anticholinergic: can't see, can spit, can't pee, can't go to the bathroom, because anticholinergic effect, it dries everything, right? So other than drying up and preventing that mucus buildup, it also dries the eyes, the mucous membrane, right? The oral cavity, and sometimes because of that dryness, it also prevents people from going to the bathroom, because it can cause some urinary retention and some GI distress, dry mouth, nasal congestion, coughing, and it can also cause increased intraocular pressure. Some contraindication, for the most part, there's none other than, known allergy. If somebody has some allergies with peanuts or soy allergy, sometimes this can be contraindicated, but that's usually from some extra ingredients in the inhaler, not necessarily the active ingredient itself. So for side effects, again, dry mouth or throat, headaches, and gastrointestinal upset. Acetylcholine side effects, so it causes muscle cramps. So the opposite basically. So if we know that acetylcholine causes cramping, increased salivation, lacrimation, then anticholinergic will cause the opposite. So basically dryness in general. Nursing actions. So we want to monitor for therapeutic and side effects, right? We want to monitor, are we getting the desired effect, and are we getting side effects? For patient education, again, we want to make sure we emphasize to the patient that this is not a rescue medication. It's more for a control medication. So it's a slow and prolonged acting one. So it's used for prevention of bronchospasms associated with chronic bronchitis or emphysema. So this is not something that they can just use and cause immediate relief. This is more of a longer acting medication. Now, examples of medication in this drug class is Atrovent or ipratropium, Spiriva or tiotropium, and Combivent, which is a combination of ipratropium and albuterol. The common one that you want to remember is Atrovent. That's one of the most commonly prescribed. And again, this is often used in combination with albuterol. And so, as you can see, they came up with a Combivent, which is a combination of ipratropium and albuterol. Now, some patients may be on it, sometimes will not. They will have to be on separate inhalers just because of insurance and also sometimes provider preference. So what you have to remember is Atrovent or ipratropium.